Hi everyone. It's great to be in the room with so many of you after working together for a year. Anna Freud at Autism, Georgia, Ruth, thank you. Thank you for everything you've done for all of us. So I'm Fleur Piacentini. I'm a trainer and an expert by experience on the National Autism Trainer Programme. So I've been delivering in trust as an expert by experience at the moment. And I'm working with people, with teams in their own settings to ensure that everyone can access updated and co-produced knowledge about autistic people and autistic mental health. So I come from an NHS mental health background. I've worked in NHS mental health services for a number of years. That includes inpatients, community learning disability teams, and autism diagnosis. I'm also a director of an autistic-led organisation, and I work in training, advisory, and advocacy roles for and with autistic people. So my motivation to join the programme was to improve the life outcomes of all autistic people. Having worked in NHS teams for many years, I've witnessed firsthand the massive misunderstanding of autistic people and how not involving autistic people in the shape and design of services has led to further harm, marginalisation, stigmatisation, and the dehumanisation of people who are desperate to be understood, and how this then goes on to affect other life experiences. Historically, the deficit model has been perpetuated through services. I've seen that firsthand. And that's because of the lack of co-production in research, training, and commissioning. And the support autistic people have been offered is based on neuronormative ideals and standards. So the National Autism Trainer Programme changes that narrative, and autistic people are being recognised as different, not less. So today I want to share with you some of my experiences delivering within trusts as an expert by experience. So number one, staff welcome training despite the time pressures because they appreciate the potential positive impact it can have on everyday practice, not just for patients, but for staff as well. After all services will be working with diagnosed or undiagnosed autistic people. The training is demanding. It's not a walk in the park. It has many modules and requires staff to engage in reflective dialogues, take notes and respond to practice scenarios. The content is engaging and organised into bite-sized modules with animations and videos that can help everybody relate to practical applications of theory, regardless of their background or experience. So, like me, your experts by experience who are trained in the programme can fully co-deliver with NHS clinical staff who are also NATP qualified, to all members of staff who want to improve outcomes for diagnosed and undiagnosed autistic people they work with. Number two, the training is rewarding for experts by experience and NHS trusts. So my work as an NATP qualified EBE makes me proud. It makes me proud of the teams that I'm working with. Their dedication. It makes me feel emotional because they've got that urgency to change. Once they've sat through this programme, there's an urgency. So it does make me emotional. That's why I'm pausing. but it gives me hope. It gives me hope for autistic people and future generations of autistic people, so that they don't experience the things that I have in my life. I don't want that for my child. So I can give you some examples of the training I've co-delivered, and I'll start with an experience of delivering with one of the national DEFCAMS teams. And that DEFCAMS team invited the whole team for training. So not just clinical staff, but they recognised that the front door was important. The administrators, the people writing the letters, answering the telephone. If an autistic person and an autistic family can't get past that front door, they're not going to access the service. So the whole team came. And that was consultant psychiatrists all the way to admin. And the team consisted of many people whose first language is BSL, and I feel incredibly privileged to have received training from the team on the deaf experience before delivery, as they thought it was also important that I had an understanding so that we could tailor the training to the relational needs of the staff. So I met with the BSL translators before delivery to ensure the language in training was accurately translated. And by the training, the team had already started to think about producing ways to adapt therapy to make it accessible for autistic young people. They also got very involved in putting the spell framework into action and getting ideas on how to work with families and schools to implement the spell framework to stop those behaviours of concern. You know, behaviours of concern, what is it? Is it an unmet need? And this is something that hasn't been asked before. Assumptions have been made. And importantly, they also recognised that it was possible that autistic children could be missed within schools and within services because of diagnostic overshadowing. So putting the child, everything down to the child being deaf and, you know, nobody considering, could this child be autistic? So by day 3, they were confident in holding conversations on how to create changes within their service. The conversations were not about fixing autistic people or incidents, behaviours and consequences, but more about acceptance, belonging and connection. Staff were more able to be curious about the behaviours of distress they see, wonder about trauma and other causes of distress, and question some of the assumptions that can lead to quick fixes that can cause harm. And since then, I've worked with another trust, an amazing trust I've had the pleasure of working with 4 times. I've just got another cohort booked in with them. And this will mean that we've trained a quarter of the workforce for that one trust. So I'm so proud of this trust and the work that they're doing, the things that they're doing. And it's inspired that trust to re-examine their policies and procedures. And a few have confirmed already that they have made those changes. So children are already benefiting from the National Autism Trainer Programme. So number 3, a safe, friendly atmosphere is provided to allow deep reflections on service culture and personal reflections. So the National Autism Trainer Programme deliveries are conducted in an engaging and kind manner to support NHS staff engagement. The emotional safety in the room during the deliveries has enabled many NHS employees to openly share with their colleagues that they are autistic too. Safety within groups has allowed biases and deep regrets to be shared. And I've witnessed staff saying how the training has changed core deficit ideas that they've had about autism. And they've reflected and shared missed opportunities and how it was they that misunderstood autistic people. We had a consultant psychiatrist in one cohort who was profoundly moved and supported a lovely atmosphere. They reflected on the things that they'd gotten wrong throughout their long career, but encouraged everyone in the room that we have to change, look at the new evidence, and get this right for autistic people. They expressed feelings of being validated, especially around their insistence not to medicate unnecessarily or over-medicate under pressure from families and colleagues. And then number 4, the final one there. Teams, after the training, engage seriously with key learning points and keen to plan actions related to everyday practice. So I know Anna Freud, the team, will soon be collecting impact studies. But until then, I just want to share a few things that the teams that I've been working with have been doing. And again, I'll probably get emotional saying some of this stuff, so bear with me. They just want to improve the outcomes for autistic people, and I think every one of us in this room does, and I just want to thank you all for that. All of you online as well. You're all here for a reason. So what are some of the things the CAMS teams have been doing that I've been working with? Some of the CAMS teams are working very closely with sensory OTs. We look at behaviour. What is it? What is the behaviour? Is it a sensory unmet need? Paediatric nurses have been recruited to perform health checks, screen for co-occurring physical health conditions such as hypermobility, and monitor for the physical effects of medication, as they could have a direct impact on behaviour. And no longer are things just being put down to a person being autistic. You know, do they have a physical health condition? We've never asked this before. Autistic people have never been asked this before. So professionals are writing neuroaffirming diagnostic reports. They're completing neuroaffirming screenings for diagnosis. And this includes exploring the focused interests, alexithymia, and social experiences of the people that they work with. They've invited partnership agencies to participate in their NATP training offer, are running 2-hour parental psychoeducational sessions fortnightly for parents. So it's not just CAMS that have this information, it's parents. And it's based around the NATP curriculum and values. And then from that psychoed training is being trained out to schools. The schools teams are receiving the 2-hour psychoed training. And some teams have initiated weekly discussions on how to embed the concepts from NATP into their daily practice. They've also produced a 1-day offer for other agencies within health, social care, and education that they're frequently working with. And then finally, some community teams have huge concerns about waiting lists and how they help children pre- and post-diagnosis. They hope to develop business plans for this, and this training has inspired this. So overall, new understandings inspired by autistic narratives have led to exciting reflections on evidence-based practices, the applications and struggles within NICE guidelines, and how to best support practitioners in identifying needs. So I know we'll get emotional saying this, but the autistic voice is being heard, and that's been missed from this narrative for so long. And so many trusts are working with EBEs like me. And the ripples from this training, from these first cohorts, they're now becoming waves. So I'm inviting colleagues here today to consider, how do we sustain this effort? How do we carry it on? We can't stop. We need to ensure that regional leads and trust leads notice and leverage these efforts and work with teams to create meaningful change. Thank you.